Hi, I'm Paul Verschoor, and I'm speaking with Annie Sparrow about the role of collaboration in public health. Annie's commitment to public health is rooted in fieldwork conducted in response to natural disasters as well as devastating combat zones. She served as a UNICEF Global Fund Program Coordinator for malaria in Somalia and is currently an assistant professor of population health and policy at Icahn School of Medicine at Mount Sinai, New York. So, Annie, welcome to our podcast. So before we really look and discuss around the topic of collaboration, maybe you could give us a short biographical sketch of your career path to understand from what perspective you look at these challenges around human collaboration.
This is the part I hate. This is the part when people ask me what I do, and I'm more likely to say that I lap danced my way through medicine and met my husband as an escort than actually tell people what I really do, which is, public health and pediatrics and working in various often more difficult places of the world, teaching and practicing medicine. This is a super interesting field, and perhaps as a pediatrician, it's easier to even think about it or talk about it because it's not a profession you can even go into without being able to get down on the ground and collaborate to figure out what's going on with one's patients. It's a bit like veterinary science in that respect. You have to be. I'm somebody who would much rather be on the ground and working with the people that I often speak on behalf of than managing people from afar.
Mm-hmm. But what interests me though in terms of background is, okay, so you lap dance your school through your time through med school, good, and congratulations, but it still means that at some point you discovered that what you really cared about was in these conflict zones to look at public health challenges. So how did that transition really happen? Was it coincidence or?
No, you're right. So that was a huge transition for me. I spent the first 10 years of my career doing pediatric intensive care. So in the UK, I did retrieval medicine at St Mary's, at the Royal Brompton, and that's kind of high intense work that takes place in kind of an ivory tower, and it's very fulfilling to do that kind of work. In Australia, like we think of it as Australian doctors, the flying doctors, if you've heard of the flying doctors. Mm-hmm. But then I was exposed to how the rest of the world lives. My brother had spent 10 years or so in Afghanistan, and I put myself in a position in Australian, going to work in Australian refugee camps to see what was going on there, because they were filled with people who were locked up as illegal queue jumpers and the type of people that we don't want here, and as criminals and as terrorists. So I thought I should go and see for myself. And that led to an extraordinary collaboration, actually, across all the different fields of medicine. So not just pediatrics, but psychiatrists, surgeons, family medicine, all sorts of, every specialty that we have in Australia. And normally we have quite a hard time talking to each other. We don't really talk to orthopedic surgeons or necessarily to plastic surgeons very much, but this was an issue, like children in detention under these very punitive circumstances in the middle of the Australian desert was something we could all get around, and we did. And as a medical community, we managed to get children out of detention and to sort of really change conditions in a way that goes, wow, that is the power of collaboration. That was a long time ago. And I think, but that was probably my starting point in terms of moving away from simply pediatric intensive care and into public health and more broadly, figuring out how to effectively advocate and work on behalf of people who don't necessarily have a voice, and how to figure out how to be effective at that. Mm-hmm. That was where I started. Yeah.
Right. But you also feel today you're still in the trenches of this kind of public health challenges, or now you stand at a different position relative to those trenches with more of an overview and more a link to, let's say, policy making, guidelines, and so on. So where do you position yourself there today?
So my position is quite interesting and unusual because I'm one of those few people who still practice medicine. So I still can get down in those trenches. And I say that by, for example, pretty much every year, except for, since the pandemic began, I go to Eastern Congo and work on an island called Ijwi, where there's about 300,000 people and they have a life expectancy at birth of 26 years. That's pretty much medieval. And there's only half a dozen doctors on the entire island. And to go there and work is something that, is deeply fulfilling for me, but also, it's a way of every year helping to give kids the best way to start the school year, healthier and better off, like by deworming them, treating them for malaria. And that's a sort of an ongoing collaboration, as it were, where it's effective because of the ability to be both a doctor, and to know how to treat people, but also to then be able to make the case at the higher policy levels. Mm-hmm. That's an interest, so it's interesting straddling those areas because not many people actually do it. I mean, WHO, for example, is filled with doctors who haven't seen a patient for 20 or 30 years. Mm-hmm. And that puts you in a very different position. There's not many of us who can be both clinicians and academic and also understand how to write policy effectively or to create the solutions that are necessary.
Right. Well, so thank you. This is very clear. Now we know where you're coming from. This is multiple directions. So, to you, what is collaboration and what is it good for?
Collaboration means that you can get anything done. And I think that is the lesson of the pandemic. Like, that is the nut we have to crack if we're going to move forward globally. I mean, the pandemic has taught us that, of course, we're never going to have international collaboration on the way that we did post-World War II, perhaps. So we need to build global coalitions more effectively in order to get things done. But what I've seen and experienced myself is that after a career in medicine and public health, where I've always been interested in other people's specialties and areas and so forth, suddenly in the last 18 months, I've collaborated with more people in more specialties within science and medicine, but also across every other sector, across trade, across business, across sport, across education. It's like, wow. I mean, mm-hmm. We really do know how to get things done, and we can. And that has also been my experience trying to, with the Tokyo Olympics, for example, where understanding how to, and forgive me, I don't know how much you know about what I've been doing recently, but in my role as an advisor at the Center for Sport and Human Rights, then a lot of us have been concerned about the safety of the Olympics and, for not just for athlete health, but for public and global health. And although journalists have been key in driving some of the issues, people don't tend to listen until you put something in an academic journal. So with the help of the colleagues that I've developed over the last year, for example, at the International Confederation of Trade Union, then I reached out to several colleagues, my co-authors in this piece in the New England Journal of Medicine, Lisa Brosso, who's an industrial hygienist, Bob Harrison, who's an occupational health and safety scientist and doctor, and Mike Osterholm, who's an American public health heavyweight across so many areas. And then to write an article that had the legitimacy of a peer-reviewed journal can suddenly start to move, mountains that otherwise aren't movable. So right. You can sort of realize that when you all come to the table with the same agenda, which is not about self-interest, but about the common good, and you each have these valuable contributions, then it's much easier to move these mountains. And I think, the currency of collaboration is trust. Mm-hmm. And I think that's the lesson I keep learning over and over again. You can get anything done if you trust each other.
Okay, but now, so you had last 18 months, you collaborated with many people in many different contexts. Actually, in some sense, if I understand it right, beyond what you had expected. But in these different areas, what made that collaboration? Is it common objectives and trust? Was that the common feature of all these processes? Or were they also different? Are there other features that we should consider?
Well, public health per se always involves, you can't really get public health done unless it's a collaborative effort. But I find it perhaps easier in my capacity as an independent clinician to work behind the scenes to build the kind of collaborations. And perhaps because, it's a criteria for being a pediatrician, really, that you're not really allowed to have an awful lot of ego or bothered about being wrong because lives are at stake. So we learn that lesson very early on. And if I don't know the answer, the most important thing is to ask somebody who does. And so I think that's how I operate, where I think I don't know, but I can know how to find somebody. I'll ask somebody who does know. And that way you establish the connections to get things done. I found myself far more effective outside the UN than within it. And I think part of that is because, the UN doesn't have, it had this kind of institutional inertia that makes it very difficult to create an ethos or a sense of purpose amongst staff that actually fulfills the organizational mandate. And I think that it is so easy to work with people when your common agenda is more important than your personal ambition or financial interest, because those things can really get in the way. And that is a really difficult issue, I think.
Well, but that's also where collaborations might face challenges. But let's focus on the ones you build. You said explicitly, I go out and build collaboration, right? So if you go out and build collaboration, how do you do that? What are the steps? Do you follow, if you want, a specific approach there? Do you have certain benchmarks that you then set yourself in building collaboration?
Well, I think that depends what needs to be done. So in my work in Syria, for example, on something as specific as a polio outbreak, well, then I know the limits of my own expertise. So then I reach out to people who I know more than I do, and I ask them. And that's sort of the thing that's so fundamental. Like, no one has to know everything. You just have to know who to ask. And in doing so, that's engaging in itself, because I think most of us want to be able to do the right thing or help or participate in achieving a greater good. And when you all bring a different thing to the table, then there's a natural energy, I think, towards moving forward. It's like, so this is what and I found that process in itself is a way to then build upon a strategy. So, for example, with Syria, my aim with polio was which is a small part of the war, the first outbreak in 2013, when polio reemerged after not having been there since 1995. But it was a way to get a much bigger interest in conflict and to rehumanize conflict. It was also a way to help accelerate getting the borders open and to remind people that health is a way which requires every other sector to collaborate. You can't get health done unless you actually get everything else right too. Health requires nutrition, it requires water, it requires safety, it requires communication, it requires a place to do things, it requires, the shelter, it requires, pretty much every other piece of the cluster that the humanitarian organization draws out. But it requires, it's just it, and I think that's what the COVID has shown too. It's fundamental to getting anything done, but you can't have, there's no such thing as a right to health per se. It depends on the right, to educate, education. It depends on getting to work. It depends on food and communication and providing people with the tools to look after themselves. So when you show people that this is how we actually are going to, move this particular mountain, then I think it's much easier to see, okay, this is my area of expertise and this is what I can contribute. And this is how we'll then build upon it to say, oh, and by the way, now you can not only this strategy to get the border open, but have you thought about the G7? And because, at that stage, for example, 2014, Russia had to provide state of the world where we were at with polio, which was another way to then put pressure on Assad to stop the bombing, for example, to create humanitarian pauses to then allow polio vaccination, but also, many other things. So, but that wasn't my idea. That was, Ron Waldman's idea, who's who's a guru at the Milken Institute, and I think that's that. When you have these conversations, then they have amazing, they can go amazing places when you're not invested and you're open to other people's ideas.
But for me, there's several things that stand out now. On the one hand, your definition of health, of getting health done, actually then only a tiny fraction of the world population lives in an environment where we get health done. Right? Because you see it more as an integrated process pertaining to the whole of, let's say, the Sustainable Development Goals. All of that has to work together constructively before we can really speak of health. So this really defines it at a very global, integrative perspective. But then you also said, earlier you said, look, I do believe everybody has an interest in serving the common good of health. Now, do you really believe that?
I think when you show people how they can actually contribute, people can be deeply interested and invested in doing so. The mistake with the SDGs is that, 17 goals, Paul, I mean, that's either adorable to think that we could do 17 things at once or just plain nuts. And unfortunately, people are, invested, of course, in each of their goals. And while sort of paying lip service to the fact that, of course, they're all connected, and the one thing that, think about this time 2 years ago, we were all, it was all about climate change, which, of course, is an enormously important global problem. But that was it. And then suddenly, in the space of a few months, we were laser focused on a single common health agenda, stopping COVID. And it showed, we can't actually get anything done without actually having a foundation of health. But we didn't really understand, and we still don't really understand how to do that and what that actually means. We even talk about, the importance of nutrition or controlling diseases and sanitation and safe water. And we don't actually realize that one of the most, perhaps the single most important determinant of our health is our work. And for children, it's their education. And I don't mean like online, but the schools. And investing in education, investing in actual work is incredibly important at a time when, education per se is one of the vanishingly few ways out of poverty and the gigantic recession. And, we can't weight all these goals equally. And I'm not sure that, saying to people, we have to focus on health first is going to have a lot of buy-in. On the other hand, health provides a way to overcome a lot of the other barriers because it is universal. It's one of the things that we can all experience in different ways, whether you need a hip replacement or a pacemaker or, and now we're all frightened of some COVID, but, that doesn't apply equally in all countries, but it is something that we all understand. So you can use it as a way to sort of not talk about the political issues that are otherwise barriers.
But there are two things here. So on the one hand, you're saying, look, you go out under the assumption that other people want to collaborate, because also they care, as you do, about these health issues. So you said earlier, look, if I don't know it, I go ask someone. But it must have happened to you as well, I'm sure, that someone doesn't want to give you the answer because they're not necessarily sharing that overall objective with you. Take the Syrian situation, right? There were people who indeed were weaponizing health, so they would not give you the answer.
Absolutely. No,
So how do you deal with that in your model of collaboration?
you're right. I mean, that's where that's a huge problem because, I mean, to a large extent, when you find people, it's because you find your co-collaborators because you have the same common purpose. So you sort of naturally attract each other and you introduce to each other, and that's how, you enter into other people's circles of trust. So, there's any number of people that I can point to and ring up and say, I need your help. And they'll just say, yes, Annie, what do you need? And vice versa, without having to go through what is it for? How much, what does it mean in terms of time investment, money, blah, blah, blah. It's just a yes. And that's the value of trust. And those people then, with those you can move mountains, or at least to a certain extent. Of course, I mean, this is the problem with the political agenda and those that are invested in the status quo, or those that, or the institutional inertia that characterizes the United Nations. And it's the same with like the Tokyo Olympics. I mean, the International Olympics Committee, President Bach makes Sepp Blatter, the ex-president of FIFA, look like Mother Teresa. There's absolutely no interest in health, public health, or global health of any kind. I mean, that's an organization that's characterized by, maximizing its revenue streams and maintaining its feudal control system. So no, there's no openness there, despite what we have worked so hard to do. But at least you can, we can try and shine a light to create greater accountability going forward so that we don't repeat this 5-star fiasco.
Yeah, but this is interesting, right? Because now you start to speak first, it means we have to qualify successful collaboration, because as you describe it now, it depends actually very much on a subset of all possible collaborations among people who do share these common, more idealistic goals and who share trust on that basis. So that means successful collaboration also for you was very much within those networks. But now if you step outside of the networks, now you mentioned the International Olympic Committee as an example, and you mentioned also Russia in case of the polio vaccination campaign, then you see it is also an opposition. Now you have multiple collaborative systems in opposition, and there apparently another approach is required. You mentioned someone who then proposed to use more diplomatic economic power, if you want, to change the approach of such an opponent, right? So is that then a natural collateral of the collaborative system? Like within, there are shared values, there are shared goals, there's trust, but between such systems, we speak about power relations. And is that then also the role of the United Nations, for instance, to manage those power relations between multiple, partially exclusive collaborative systems?
Well, it's certainly their role, to broker those relations and to provide a platform. It's not something they're clearly very successful at doing so, and we all know that. I don't think, there's been that natural trajectory towards, self-interest, nationalism, and retreat from multilateralism, which doesn't help. Historically, there's always been a commercial interest, particularly for, public health. And I say that where, 150 years ago, the nations started meeting and arguing over the cholera pandemics because they didn't want, Europe and America and the UK infected by those, Asiatics or those Muslims bringing cholera into, across the Mediterranean. But they argued about it for like 4 decades worth of sanitary conventions and conferences. And the only reason that they then became to a consensus was when the British lost control of the Suez Canal in 1898 or so. And when it opened up, then there was a commercial, common incentive to actually standardize quarantine measures. So that drove that standardization. And that then became the sort of international sanitary regulations, which were the forerunner of today's international health regulations, which countries are meant to adhere to, particularly to control pandemic threats. That's but that only goes so far. We can say the same thing. I married in New York, and New Yorkers are very famous for talking about their tap water, which is delightful, but it wasn't always like that. We all know the history now, courtesy of Hamilton, and how the famous fight between Hamilton and Aaron Burr resulted in Aaron Burr took the money, created a bank, forgot about the water, invested, I don't know, like a few thousand relative to the 200,000 that was meant to be put into it, and it took another 6 years, and it wasn't until people started complaining about the taste of their beer that the water source became cleaner. And so it was again a sort of a profit-driven incentive. But I don't think that's enough anymore, because without trust, a commercial incentive also is not enough. We have seen the fact that there's a commercial incentive to vaccinate everybody, for companies to transfer tech, to waive the IP. It's not happening. And just saying that, we would make the world would be, more profitable if we did so. Well, that is not a sufficient argument. And that's, it's not enough anymore, I think, without figuring out the ways where we reconnect to each other. So that's when it comes back down to this global shortage of trust, which should not be a surprise. I mean, investing in a vaccine is amazing. We can see the power of scientific collaboration to produce these vaccines. But if you don't invest the same amount in figuring out how to get people to roll up their sleeves, the best vaccines won't work without social traction and trust. And quite apart from the misinformation that is deliberately sown, or the conspiracy theories, I have found time and time again that showing up, and listening, and building those relationships of trust, that's what pays dividends. But you can't do it, with that aim. It's like, it has to be an agenda that with an integrity that is without intention. And that I learned that. It took me a long time to even learn that lesson. And I'd say that with humility, and probably the arrogance of thinking that, I knew what I was doing. But I went back to Syria with my son, who made me go back at a time when I felt I had nothing more to give, that I was kidding myself if I was doing anything more than a drop in the ocean. And I was, who did I think I was? A white Australian showing up, treating a few people with typhoid or diagnosing a few cases of polio. And he said, "Mum, there are friends. We have to go back." And it was that taught me, the true value of solidarity and hanging out. And it's, it's years later when we need each other, and that trust is there because it's built on a foundation of that is, there's really literally built on the ground, being together, eating together, sharing together, laughing together, and crying together. And
but now, can you describe in more detail then how you build up this polio initiative in Syria? Because it's one thing to decide to do it and to create the conditions so that can be done, but then you need a huge network of participants who actually are out in the different clinics or the shelters or whatever to inoculate people. Plus, you must convince the population to also participate in this. So how was that process structured?
That's where the Syrians did that, not me. I mean, I was somebody who was simply started going there to explore this relationship between health and human rights, because I think that when you violate people's human rights, it comes out in health, both individually and at the population level. But because I was there, and as a pediatrician, I gradually became involved, increasingly involved in and open to, providing advice and help and clinical services and training wherever and whenever it was asked with me. And because I kept going back and back, I started going to the border first in Lebanon and then in Turkey. And then you develop these relationships of trust and access to those networks. But the Syrians were amazing at managing the polio piece, which the government in Damascus was busy trying to cover up and had no interest, of course, in vaccinating the northern, politically unsympathetic areas which had been neglected for years. That was, I think that's the power of a civilization which has enormous sort of reach within its networks and enormous sort of trust within itself, because like that can't happen unless that has been there for a long time. I mean, they are very civilized people to be able to pull off these amazing, massive campaigns and get 92% of the population vaccinated at a time of conflict. I mean, we couldn't do that in the States.
Mm-hmm.
I mean, look at what we're, so it's that, this is the thing about trust, of course. It's a long-term investment. And I was sort of able to be the person who conveyed it at a policy level and could write about it and hold the argument. And of course, as an advantage, it sounds really precious, but I have a lot of degrees after my name because every time I change countries, I have to requalify. So qualified in Australia and the UK and the US. But it's helpful when you need to have the argument. And I spent some time at Human Rights Watch learning the law as well, so I could understand the law. But it's then, I can then sort of take the heat, as it were, so that Syrians could receive some funding and support to be able to do these things and to protect their population. But I can only take my hat off and kneel, thinking I've never seen a population withstand so much and still get so much done.
How did they do it? Was it top-down leadership? Was it bottom-up trust and a shared set of values and goals? How did they do it? Can you explain it?
It was certainly driven from the ground. It's the people who stayed and made that choice to keep working, to volunteer. I'm not just talking about the doctors or the nurses, the pharmacists. I mean, and honestly, like the pharmacists and the dentists are absolutely fundamental in that kind of situation because they're super good at managing both the logistics and understanding the patients and their drugs and so forth. Where doctors alone, like I can manage a cholera camp or an ER, but you really need a dentist or a pharmacist to do all of the supply chains and get those things done. That's a huge feat. But the process of it still is remarkable to me, and it's a very good question. And I would need to come back to you more about that. I feel that they demonstrated solidarity in the face of such brutal oppression and determination that they would do it for their children. Like they didn't go out. They didn't decide to stand up and to figure out all these different ways of dying. Being shot at, being starved, being tortured, being, gassed, being bombed, being incinerated. They came out to figure out all these different ways of living for their children. And you think that, we will all do anything for our children and they would figure that out too. But the masses of people who became, volunteers or paramedics who educated themselves, and they shared their sort of skills in a way that is contradicts what we understand of medical ethics. You're not allowed to operate in anybody else's field, but you have to do that, in war zones and in these settings, and to share skills. And I think that, when people can see the lengths to which you will go to help protect, children from being paralyzed, needlessly suffering, then that also, it helps then, at the receiving end. But it is also a lot of work. And you can imagine too, where, Western, like say the children, for example, would come and do a cultural sensitivity exercise. So you have to get everyone in the village and you have a lunch together and you say, this is what we're going to do. This is why we need to do it. We want your help in planning, whether it's a polio campaign or measles campaign. Oh, and then we need all your signatures to sign so that we can get reimbursed for the lunch. It's like, seriously, I mean, it is like, how it's just so insulting in a way that you think, I cannot believe that you would you would do these things that are then, so counterintuitive to how what we would really call cultural competence.
Mhm.
And especially in such a population that is so generous and hospitable and is suffering such tragedies.
But in the polio campaign, would you also see people collaborating across the lines of conflict? So people who were supporters of the government would still work together with the revolutionaries, so the people who want to build a new nation. They would still work together across these lines of conflict in order to advance the polio vaccination campaign.
As far as possible, absolutely. I mean, it's much more so from the north, who would, with the northern ethic was like, we will help people everywhere insofar as possible. So, for example, yes, they would hide the polio canisters in milk, in what do you call the big, canisters of milk, hold the polio vials in milk canisters and, disguise them so that they could cross into villages that were under government control and then vaccinate, kids. And they would then not you do the usual marking of the finger with purple ink, because otherwise, then the retaliation could be expected. But certainly, some government people would, look the other way in order that this could happen, because there is common understanding. But I mean, that is also was deeply impressive. I mean, the polio vaccination campaign was so successful that in the end, UNICEF even encouraged and supported the Syrians to cross the border through Iraq and vaccinate those in Iraq as well, because we know too that polio actually spread into it. And so that was the extent of the trust and the reach that they could actually do that. And that was only because people stayed, and they stayed, and they demonstrated, I suppose, every single day that they were going to do the right thing, no matter what.
What's the vaccination rate? What was the end result there? How big a fraction of the population got vaccinated?
Well, the first round alone was 92%, which was just massive. I mean, the polio doesn't. You wouldn't expect to have that high, especially in a conflict zone. And you have to do several rounds, of course, multiple rounds, 6, 7, 8, 9, and certainly that's what stopped the polio outbreak. And it took several months, but that was successful. I think by the end of it, then 93, 94% of the population was vaccinated, and then despite government undertakings, of course, it then came back in 2017, but this time it was vaccine-derived polio, which shows too that there had not been a serious effort to vaccinate the population.
Right.
By that stage, Derazor was under government control, because vaccine-derived polio only comes back when you haven't vaccinated people for a long time.
Right. So this is a massive public health effort. It's collaborative, right? As you described it. They reached 94% more or less vaccination rates. Now in the US, in response to COVID, where we have infinite resources basically to get the population vaccinated, for the last 7 months or more, we have reached about 50% vaccination rate. What's the difference between these two collaborative systems?
Well, it's been a very long time since we've actually paid any attention to the importance of trust. And we have adopted a model that is disease-driven and subordinates people to the virus and to the vaccine. So as long as you do that, it's very hard to see how we will get sufficient social traction to get people to roll up their sleeves, because we are effectively saying this is all we need to solve the pandemic. Everybody has to get vaccinated. Well, that's not true. I mean, that is absolutely not true. And we see that right now. I mean, more broadly, across the world, the effort that has gone into sort of this, let's keep those nasty diseases there in the what we would used to call the global south, will make every effort to make sure that Ebola or SARS or, whatever the threat is doesn't come here. But we won't address these, quotidian killers like malaria or the other ones that kill your children much faster and at a much higher rate on a daily basis because they're no longer a threat to the West. And that is not a ethos that can, last very long. And across America, we can see that people whose health has been neglected, they don't have services, they don't have, access to a decent standard of living, a great job, their kids are not going to school. If you ignore the what we would call the social or the political or the economic, the environmental determinants of health, and all that we say is you just need to be vaccinated. Well, that's not true. It's a very negative approach to public health, and it ignores the positive, issues like, if we want you to stay home, let's give you some social protection. Let's give you some financial protection to actually allow yourself to withstand this. Let's give you the tools to look after your own health. Let's give you everybody rapid tests so that you can test yourself every day and have some agency. These are measures that actually build trust so that when a vaccine comes, you are much more likely to accept it because you're actually part of the solution. But, this paternalistic, prescriptive approach, which has, ignored the importance of communication and says, do this, do this, do this, and hasn't explained along the way, and takes a long time to update their priors. So, telling people to wash hands and wash surfaces when it's an airborne viruses. And then when you finally say, okay, in May, okay, it's airborne, but you still fail to actually say, okay, now this is what we need to do. Not very helpful. And it's saying mask up everybody at a time when masks are even probably becoming less effective as Delta virus and Delta variant and the others become more infectious. What are people going to do? It's like, a year ago, we watched the world lay down their tools willingly to control this. We've never seen that kind of paradigm before. Of course, governments, said we'll have to shut down, but people did it willingly and we shut down. And now, of course, people are fed up, not only just fed up with the economic, cost, but because where is the truth? Where is the trust? We're not going to do something unless we can see why we have to do it. And where are the tools that give us to engage us?
But in your description, in some sense, what you are then saying is that the COVID-19 crisis also shows how healthcare systems are not working anymore as collaborative systems.
Absolutely.
And in that way have lost effectivity from a public health perspective.
Well, we commoditized health. And the minute we made it into, a commodity, then it stops being health and, healthcare. The real global public good here is not vaccines, it's care. And that's what, the Syrians demonstrate in spades. They know how to care for each other. They have an architecture of care that is just so obvious and so deep that it cuts across racial, ethnic lines in a way that is, we need to learn from that. And we need to remember that, even investing in healthcare workers, which we obviously need to do of every kind, not just, of course, doctors and nurses, but the janitors, the porters who, push the trolleys, everyone who's in the line. But it not in itself, it's hard to see how that will work unless we also invest in caring for each other, and that theory of care, is that what it's called? But it's that, but part of that, of course, is finding the tools which help us reconnect at a time where we're already disconnected and digitally living. And some of those tools include things like rapid tests, which can help us then look after our own health, our family's health, our community's health.
Right.
And those are the building blocks for collaboration.
But this is what we see here as well, is that with that we reach the end of the sustainability of healthcare systems, right? By commoditizing health, especially in the US, it also is at the point of just not being sustainable anymore. So is the current system future-proof? Or are you arguing for a complete reorientation here of the approach towards health? that is then based on collaboration and different values. How do you see that?
I think it's essential. And this is the opportunity because, we've gone as far as we can with this biomedical approach, that there is an antibiotic or a drug or a treatment for everything. It's not. I mean, Pasteur was a PR genius and he really knew how to market, the germ model, and he did. And that really was the point at which people diverged from Berkhoff, and who fully recognized the importance of social justice, of shelter, of decent living, of a decent standard of living, of a decent job, of all these other things that are the building blocks of health. And we simply went down the biomedical model as if every disease has a one single cause and there's a drug or an antibiotic for all of those. That's just not true. And it's pretty lazy, actually. I mean, it's low-hanging fruit, right? It's not.
Sure.
And that was when WHO, when the World Health Organization actually was, created out of the ashes of World War II, and the health office that was in Geneva, it recognized this shift that health wasn't just the absence of disease, but the presence of physical and mental and emotional health. I mean, mental health, we know, is like a prerequisite for physical health, but we still just pay lip service to it. But, even having recognized that, and it was given the mandate to sort of get beyond these negative approaches to public health, which is like vectors and vaccination. Vaccination, of course, we love it. It's our preferred tool of mass salvation, but it can only go so far. But, that approach didn't last very long because Cold War starts, Iron Curtain comes down, and the superpowers prefer the model of disease diplomacy and sharing vaccines because it's much easier than actually putting in place these other measures. Governments like short-term solutions. They don't want to invest.
Well, but maybe it goes actually deeper, right? Because also if you look at the scientific models, the epistemology of it, reductionism is the way in which we often end up looking at the world, even though what we try to understand are multi-scale integrated system. And with collaboration, we of course face a similar challenge. But it also means that the way you described collaboration in public health is actually a very tiny minority of all our activities within health systems and in public health, right? The majority sits more in this incentive-driven, highly fragmented commoditizing of health. And then, of course, where of course we have enormous artifacts that are very costly for society. Take the opioid crisis that the US is facing. But are you fighting a rearguard battle here? Are you the last of the Mohicans of how things could have been? And we're off just in this direction and there's no return because, of course, the power behind it is enormous. Health as a non-collaborative, if you want, neoliberal exercise. Do you still have a chance to change that? And if so, where would you start?
Well, I suspect you are too. We are condemned by hope. And we didn't always have this homo economicus approach to health, nor did, when you look at what Rockefeller did at the turn of last century, they did basically what Mackenzie Scott is doing now, where there's a willingness to actually put money into areas that, with a high degree of trust. And because we have to actually find a different way. I mean, it's very clear now with the variants that this here-there approach isn't working anymore. We can't keep things there. And all we're doing, I mean, we did it before with HIV, and while we won the battle in terms of making HIV drugs accessible, we certainly lost the war with big pharma and patents. But, the idea was, or the rationale was that we can't, they can't have them in the global south because people aren't literate. They won't be able to read, the labels. They won't take them on time and will create drug resistance. That's not true at all, of course. And that was disproven because Africans are much, much better, more compliant, and than many, than people across America. The rationale, but, 20 years later, have we conquered HIV? No, because it's much more than about making drugs cheap. We have to address all the other issues that go into, why people have AIDS and get AIDS, and the agency and the, all of the human rights and the issues that, it's like giving a woman a woman's ability to inherit property will protect her, not just from aid, but from poverty and from domestic abuse, and, provide her children with a much greater ability to go to school, et cetera, et cetera. There's an importance of actually recognizing the linkages that mean that you can do an enormous amount if you put in a legal framework and uphold it, for example, and you understand those connections more deeply. But, looking at the variants, we have created, the equivalent, the viral equivalent of the Hydra, the 9-headed monster. Every time we create a new vaccine, it doesn't matter. More heads will keep appearing. And if we can't learn this lesson now, then yes, we pretty much are doomed, because the next pathogen is almost certainly here already. We haven't identified it yet. But an approach to public health that is limited to vaccines and doesn't actually start with people as part of the solution and figure out how to produce this groundswell of collaboration. I mean, we can do that. And that's actually the only way you can defeat. That's the only way that we can defeat the virus. I mean, human collaboration is formidable. But as you say, the monsters that are lined up against that are also considerable.
Right. But in some sense, the medical professionals are one of the big obstacles in the way of building a true integrated health system. Or would you not agree with that?
Go on.
Well, look, they are the ones who are representing also a part of these power structures that have been following this route of the commoditization of health. They have been selected into that system. The ones who have more idealistic goals are not part of it because they wouldn't survive in that environment. It's highly competitive. It's very much about the monetization of health. The guys who are good in that game will protect that game because this is how they actually are important, have status, and make lots of money. And of course, usually they're guys. So are they not one of the big obstacles we face? Because in parallel, as you also indicate yourself, actually, for many pathologies, we see very little progress on actually curing anything because people are just climbing up the wrong tree and they think they're getting to the moon, right? So is this actually not one of our biggest obstacles, that the way we have currently implemented health as a non-collaborative system is the first thing we have to dismantle to make progress?
Yes, everything you said is true. I think dismantling something is very difficult, and it's probably easier to provide a way forward that enables people to start to collaborate positively so that they don't have to necessarily detach or declare, their attachment to that model.
What's the way forward if people are so conditioned around their incentives? So can you sketch that way forward?
Well, perhaps it's easier to start with places where this conditionality or these conditions aren't already cemented. And I say that where, across Africa, for example, people are really tired of looking to the West for solutions. And we see like this hypocrisy where, Gates on the one hand forces, Oxford University, which are providing the only open source vaccine, to partner with AstraZeneca, which, has never produced a vaccine before. And because Gates actually perceives IP as the lifeblood of the universe, which of course is nonsense and is toxic and then by contributing also to COVAX, which is aiming to supply the world that doesn't have access to vaccines, and that's just hypocrisy of the first order. Meanwhile, Boris, of course, withdraws 95% of development from, developmental aid, which is so much, to Africa, including, 100% of family planning, because of course of the US's attitude in the global gag rule, but then says, but we will put, $1 billion into vaccines. It's like, this is nonsense. And, there's no accountability for these kind of pledges. But meanwhile, like Africans are, at that point where I think, okay, let's start here where we can divest ourselves of this Western, the West being addicted to, to developing, us, as it were. There's enough, I think, across Africa, there's enough innovators, enough, tech, enough people, enough, there's a rising sort of middle class and wealth that means they can invest in their own health without having to, go down that Western model of a biomedical model and putting the disease first. I think they can see much more clearly that the only way to actually stamp out these diseases is by making people healthier. Mm-hmm. And that starts with the actual conditions in which people live. Right. And it starts with exploring, it's not that there aren't, there are certain tools which we think would make people a whole lot healthier. We know that fecal transplants are incredibly successful at making our biome healthier and protecting us from all sorts of diseases. We know that viruses are responsible for at least 25% of all of our cancers. So how about we invest in more live vaccines, which we use anyway, like, BCG, measles, oral polio, which we're all familiar with, and especially are well used across Africa and Southeast Asia as tools which might actually protect us against a lot of these expensive diseases, so we don't get them in the first place.
Mm-hmm. Right.
So I think that we suffer from a global failure of imagination, and when it's going to be very hard to get people to detach from our addiction to this biomedical model. I fully agree. So I think it's easier to start where it's possible.
So, but then before we go for the final few questions, I would like to go back to your involvement in the Olympics that are running right now, where overall the situation is not great, right? There's also lots of debate about the actual quarantine measures taken, about the testing and so on. So you wrote a paper and published in May, where you were urging also the International Olympic Committee and the local organizers in Japan to rethink the measures they took. Well, so in that sense, that's also an invitation for a collaborative effort to find the best way forward. So did your paper have that impact?
No.
Okay. And why not?
Because they don't want to collaborate. And that was very clear right from the beginning. Obviously the natural people to collaborate with are the athletes or the athletes associations themselves. They're the ones who have gained all the wealth of knowledge, of expertise, best practice over the last year and a half. And I say that as somebody who was involved in, counseling the Women's National Basketball Association, last year. And they had a really successful season, 87 games without a single positive COVID case. But, but instead of actually inviting the people who know what they're talking about, the World Players Associations, for example, and the experts that, I am not an expert around sport. I've known people who are far more informed than I am. But I know who to ask. And it's like the Center for Sport and Human Rights is full of experts where you think, okay, why don't we just find out where the experts are and ask them? But instead, there's this ethos of handpicking experts who the IOC know will toe the party line. And there's also a fear that if they step out of line, they'll be excommunicated. And even though we were, myself and Mike Osterholm, who was, such an amazing man, an American public health heavyweight who has, no fear, and it's such an expert. Instead of actually really listening to what we're talking about, they're just really paying lip service. And we can see that because, how can you, relying on vaccination is a nonsense strategy when you could already see vaccine breakthrough. And we know that vaccines were fundamentally their primary purpose is to stop severe disease. It's not to stop spread. So instead of taking a science-based approach or a risk-based approach, they sort of create this charade, and then how can we be surprised when it doesn't work out? Mm-hmm. So, the good thing is that because of that paper, we have raised the stakes, to a much higher level and created a lot more awareness about what's really going on, because there's a huge lack of transparency. How do we know what's going on? How do we know what their real testing protocols are? How do we know, how people are living, eating, sleeping? The athletes themselves, the mental health, they have a hotline, Paul. They have a hotline for mental health and for women or for anyone, who gets sexually assaulted. which shows you a lot about this approach. It's like no one is going to report. So that's a great way of saying it didn't happen. Who's at the end of the line? I'm not, that's a bit of a, it's not meant to be a diversion or digression, but it's sort of epitomizes their whole approach where they're not taking it seriously, but they are investing measures that look like they take it seriously. And meanwhile, there's this, disregard of athlete, public, and global health.
But there's an interesting aspect to this, right? Because there are two ways to interpret the International Olympic Committee's response and the Japanese organizers. On the one hand, it could be that they have just alternative objectives. Their goals are different. Their goals are essentially in collision with the ones of public health. They're not telling you what these goals are, but that's why they are not listening. This is one possible interpretation. The other interpretation is it's sort of plain stupidity and mediocrity, that people are following in a sort of a habitual perspective on how public health should be organized, how these kinds of events should be organized, and they just march along that habit. And if you challenge them to deviate, it is just rejected because the world looks just fine from their habitual world model. So which of the two sides would you take as your interpretation of this lack of response?
You're right. I mean, it's one of the most frightening things is colleagues that I respect deeply who are utterly convinced, or who have been up until the game started, that everything was absolutely fine, that we were, drama queens who were banging on about nothing, that vaccination would protect everyone, and it's not a big deal. And you think, wow, I'm not sure, where you're standing. The world looks very different from where, to me and to my colleagues. But I agree that there is this combination, this fairly lethal combination of mediocrity and complacency, where we have forgotten the importance of public health. And we have, we've had, the pandemics of the 21st century before, SARS and H1N1, which should have been, dress rehearsals for this, have been really interpreted as that, oh, well, it's never going to get that bad. Mm-hmm. And, the last century, people talked about the death of infectious diseases, which is, of course, is deeply arrogant. I mean, we're facing, pandemics and climate change and antimicrobial resistance. Those are the three global narratives that affect us all, and once our antibiotics go, we are really...
Well, humans have declared victory over many natural phenomena on many occasions to again get bitten in their backside very rapidly. But so the time capsule we're going to send to one of the possible inhabited planets in the future will just say, look, we killed this planet out of stupidity. This is our main opponent in building collaboration?
Well, certainly where the IOC is concerned, they have a long tradition of rising above the rule of law. I think that we can see now that, you can only rise above the laws of nature for so long. But, we don't. We should take a cue from the virus and understand that this is the opportunity for change. And the Olympics work a whole lot better. People perform better, higher, faster, stronger together when we can create the best environment. And it's, one that when you do that right and from the right intentions, then it's a more profitable environment as well. It works for everybody. It's a global win-win, which is one of the most tragic things, because that's where, let's, instead of having these bilaterals which are non-transparent, let's have the kind of conversation where we can all see the advantage.
Right, but there's another thing that worries me about your paper. Look, it's published with some real experts in one of the leading medical journals in the world. We have our mouth full continuously about evidence-based medicine. Well, here's the evidence delivered in a highly credible, high authority journal. It has absolutely zero impact. So is it actually just pretense that evidence matters in these debates on global health?
Well, that is probably that's the real question, isn't it? The evidence from the very beginning of this pandemic has been that it was airborne, microscopic, asymptomatic. We could see that right from the beginning, where the Chinese doctors that were infected were not the ones in the ER or the ICU like we saw in SARS. It was the family physicians, the ophthalmologists, the elective, people on elective surgery wards, and the surgeons that showed us that it was being transmitted asymptomatically and it had to be airborne. And of course, the Chinese cover up, and governments always cover up epidemics. We know that. That's pandemic 101, public health 101. But the problem for the World Health Organization is that the countries, because they all adopt this stance of you're not going to come in and cross our boundaries or interfere with our sovereignty unless we say so. They have no independent ability or financial clout to be able to figure out what's really going on. And so despite the obvious airborne and the evidence, and a lot of scientists put a lot of serious effort into getting this out there, it took an enormous amount of time for both the CDC and the WHO to update their priors, and we didn't see that till May this year. And you think, wow, I mean, this comes back to the importance of communications, and even well before evidence. That's the precautionary principle. After all, it's like, this is what the evidence looks like, and we know that that for a disease that's operating like this, let's adopt airborne precautions. Let's mask up. Let's look to our ventilation. Let's look to air filtration. Let's figure out, and we can see that that is part of the problem now. We didn't do that. People haven't been honest about saying, okay, we screwed up here. Fauci himself said, I'm sorry, I got it wrong. It makes it much easier then to listen to him the next time around.
But there's a real issue here, right? Because if you put in this effort to write this paper, put all the arguments together, and there's subsequently no response from your target audience, the IOC and the Japanese organizers, it erodes trust in public health measures. It erodes trust in the science behind it, because the general public says, well, these people make all this noise, but the guys with power are not impressed. So aren't you now obliged to keep on hammering on this message until they give in, just to safeguard the trust in medical knowledge?
Well, certainly I'm not going to give up my position or my importance of evidence or my standpoint. And when I say that there's no impact, I mean, I'm probably sound far too binary. It certainly has created a much more potential, even moving forward, to hold the IOC accountable for this 5-star fiasco. And that's super important, because this cannot be the global standard going forward. I mean, and that's, we have the opportunity at a moment in time where we can actually see the importance of science. And, then let's hold on to that rigor. Let's hold on to that quality and hold that line and use it to inform, our events, whether it's the Olympics or the football or the Beijing or the World Cups going forward or the Dubai Expo or whatever it is, getting back to school. I mean, let's use that evidence and let's hold the line on the quality and the rigor that we know. And let's, it is important to actually, stop, call a spade, like all the big winners of this pandemic have been the tech guys who, continue to churn out these, ridiculous contact tracing apps that, do nothing, haven't shifted the level, the dial one iota. And yet there's all this pretense and lack of evidence that they do. It's like, let's, there's no app for public health. It's not easy. You have to go out there and do the work. And it is work. And it is harder in the face of all of this, people's addiction to easy wins. But, a cheap win is just that. And it's not even a win. But, with an opportunity to actually put people first, we have to do that. And we don't. And we know what that looks like. It's not rocket science. We have to invest in it. Otherwise, we don't.
So, anyhow, my last two questions, so on the one hand...
You're not demanding, are you, Paul?
No, not
my
at
last
all.
two questions. Okay.
So, look, do you believe humans will ever succeed in building sustainable collaborations in this domain of global health? Is it even possible? Will we be able to?
Yes, I do.
Mm-hmm. Okay.
I do. That is my experience from the pandemic. I do believe. I mean, I I look around and I see all these different connections, and I'm grateful to them all these new colleagues and collaborations that have enabled, certainly have enabled me to try and do my best to help advance, to take part in this endeavor. So I think yes, it is possible. Maybe I am condemned by hope, but
yeah. But now, if you could change one thing in humans, let's say we give you the most advanced technology, you can change one trait of humans. What would it be so that they could achieve sustainable collaboration?
well, I think this is the collision of Homo economicus and and very fundamental. What is the other? The human beings that are able to cooperate and to overcome these global challenges have to be able to put people before profit. So we have to give up our addiction to money, recognizing that there's a limit to capitalism and to this model of Homo economicus. That means we can go so far down this model. And if you carry that model to the natural end, well, then I'm sorry, you're going to kill so many people that you're not going to be able to make those profits anymore.
Right.
We're not going to see big pharma change, because drugs are the most profitable industry on the planet. So that's maybe why that's one trait that I think has to change if I could actually change anything.
Okay. Annie Sparrow, thank you very much for this conversation.
It's a pleasure. That was a pretty tough conversation, Paul. You're pretty demanding.
Hi, you listened to one of our podcasts in the series on collaboration, produced by the Instrument Forum and the Convergent Science Network. You can find more episodes on our website.